Good evening to everyone and welcome to today's session. I hope that today's paper is moderately tough with some very good questions in medicine and gyne-ops and relatively easier questions in subjects like forensic and preventive medicine. So we welcome our online students Dr. Ritu and the students of Tirupati, Guntur, Kurnool, Kakinada and many more students celebrating their Diwali this day across their homes who have a privilege of attending this session directly from the home, a lot of online students. So let's make the great beginning, doctor. You're all well settled? Finish your paper, I hope so. So which part of the hypothalamus is related to sexual behavior? Nalini, what is your opinion on that? You have not answered that question? Huh? No. What's the possible answer? Very good. We get an answer as medial preoptic nucleus coming from Dharani. Very good. Medial preoptic nucleus, what is your opinion? Very good. Even Tara and Jeetu are also thinking the same in the online. So you must know, doctor, medial preoptic nucleus, supraoptic, paraventricular, suprachiasmatic. One of the questions on the hypothalamic nuclei is one of the favorite area of the examiner. Tomorrow's exam, when it comes, you will remember me, but you need to review that. Lateral nucleus is important for the thirst and hunger. Suprachiasmatic is for our circadian rhythms. Paraventricular nucleus is important for oxytocin release. They are all the very standard questions. But you have to somehow mug this table because this is a common area for the examiner. In the inguinal canal in the females, which will not pass, doctor? Give me one confident answer. Question number 2. A. Inferior epigastric artery, even Dharani, Shweta, everyone is saying A. Inferior epigastric artery. Inguinal canal boundaries, doctor. Right from our MBBS days, it used to be the anatomy practical exam, dissection of inguinal canal. Male is what we remember. Muscles, epineurosis, ligaments and transversalis and conjoint tendon, T for 2 T's. If you arrange it this way, it is in anti-clockwise starting with A. Anterior wall you have all aponeurosis, which include aponeurosis of external oblique, aponeurosis of internal oblique. Then in the inferior wall, if you go anti-clockwise, you have got L, ligaments, lacunar ligament, inguinal ligament, iliopubic tract, etc. Then you have the posterior wall where you have 2 tendons, conjoint tendon and transversalis fascia, T for 2 T's. Ultimately you have internal oblique and transverse abdominis, which are the part of the superior wall, which are the muscles basically. Now doctor, alpha defensins, who is the one who releases? Question number 3. What's your answer, doctor? You want to say Paneth cells? Shruti, what is your answer? Paneth cells? Beautiful. Even Asha, Shiloh and Jiaul Haq, they are all thinking the same. So it is in the small intestine. Please ask our Secunderabad students. Today we have almost a century, 100 plus students taking exam in Secunderabad. Next week we are going to have a ranking that we can give across 1000 among AP, 1000 plus students in the AP. So nowadays a lot of students are taking online exam also. That's the reason OMR sheet based analysis has altered numbers. Okay, Now doctor, let's take up the next question. 27-year-old cyclist from Pune has weakness and intense pain in her hands. Which nerve is injured in the handlebar injury? Dharani proposes ulnar nerve. What is it up? Ulnar nerve? Very good, beautiful. So ulnar nerve is the one which is typically injured, which is called as handlebar palsy. Now, for the medial rotation and adduction of the arm, if you have to carry Harrison to the reading room, typically you need to use this muscle. Which muscle? Adduct the arm and medially rotate it. Typically it is the subscapularis which is helpful even to comb the hair if you have the hair. Now coming to the bronchi, which are richly innervated by the ANS, what happens with vagal stimulation? Easy question. Work of breathing will increase because that lead to bronchoconstriction is what need to be remembered. What is wrong about sham rage? Farhan, what is your answer for this? Doctors, you give placards to all the doctors. What is the answer, Farhan? D. Very good. It is not goal oriented. Very good. Suppose if there is any lesion, there are two important centers that will decide the rage. One is called the placidity center, other is called the cerebral cortical centers. So the ventromedial nucleus is called the placidity center. If at all there is any lesion in this, if you slightly stimulate also, there is a overreaction of the autonomic nervous system. So that increased heart rate, BP, erection of the hair, everything will occur, and biting, clawing, tendency to attack, somatic reactions occur. So both the mesencephalic and also the hypothalamic lesions lead to the development of sham rage, which is not goal oriented. So I leave to you in the literature, spinal, low decerebrate, high decerebrate, hypothalamic and decorticate as you go up. What will be the features of the animal in different scenarios gives the physiology behind localizing the lesion in neurology. Now doctor, what is this kind of posturing? It's called decorticate. Elbow, wrists and fingers are flexed and legs are extended and rotated inwards. Then you have decerebrate rigidity, which is fundamentally an extensor posturing is what you need to understand. So if you look at a calcium isotope during contraction, to what it will go and bind? We get an answer as troponin. Even Shamim proposes troponin. That's good, doctor. Very good. Now a 6-year-old boy is playing in a dusty field. In a dusty field, in a windy weather. So what is your answer? Which is important for clearing the particles? It is the ciliated cells. I think simplest of the questions in the world. Now large left ventricular stroke volume. ये बताओ डॉक्टर, ये correct answer करे तो आप our future cardiologist. चलो, LVSV, left ventricular stroke volume is high and left ventricular end diastolic volume is also high. Good, lot of cardiologists here. So why left ventricular end diastolic volume is high? Because at the time of the diastole, aortic regurgitation occurs. Regular venous return will come and regurgitant blood together will increase the volume of end diastolic volume, and all that will be pushed into the stroke volume by the heart. So that is the reason you get both of them elevated. What will be the situation in case of mitral regurgitation? In mitral regurgitation, stroke volume doesn't alter, but the end diastolic left ventricular volume will increase. That is the point of interest. Now doctor, GLUT 4, GLUT 1, GLUT 3, GLUT 5, examiner will bargain with you in the exam hall. What is your answer? GLUT4, I get an answer as skeletal muscle from Shamim. Shweta, what is your answer? Skeletal muscle. Beautiful. I think now you are all teeth to teeth for a fight. Any day be the exam. That should be the spirit. So remember, doctor, that the brain is having GLUT1 receptors is what you need to remember, and intestine has got GLUT5 receptors, kidney has GLUT2 receptors. This match fixing you need to be very good with. What do you have in the neck of sperm? Huh? Krebs cycle, because it has got mitochondria. Beautiful. Then a 10-year-old child with history of self-mutilation, what is the syndrome? Lesch-Nyhan. So there is a reason hyperuricemia is a feature of HGPRT deficiency, as all of you know very well. The glucocorticoids activate the phosphoenol pyruvate carboxykinase. What does it normally produce? What from what is catalyzed by phosphoenol pyruvate kinase? Srinivas, what is your answer? Propose something. Question number 14. Fahima is proposing oxaloacetate, and yeah, what's your answer? Yeah, oxaloacetate? No, doctor. Clean bowl. You said phosphoenol pyruvate? Huh? Very good. So PEP carboxykinase is a cytosolic enzyme which will be converting oxaloacetate from the TCA cycle to phosphoenol pyruvate. What did we ask? Ultimate product is what we are asking, not reactant. That's where Fahima misses very slightly on reactant and product. So glycolysis, gluconeogenesis, glycogen metabolism, fatty acid biosynthesis and degradation, and porphyrias. That's all is called biochemistry for MD entrance. Now doctor, glycogen storage disorder mein myoglobinuria is there. First, which glycogen storage disorder it is? McArdle's, where we require myophosphorylase. What is its normal function? Answer is? You like to choose? Huh? You like to say? Shortening of the glycogen chains. Glycogen is broken down into glycogen N is broken down into glycogen N-1 plus glucose 6-phosphate, right? So that is the main function of it. Question number 16. Please ask our Gandhi Mushirabad students also to punch the answers. We love to see Lakshmi bomb like answers. So have you cracked yesterday? Lakshmi bombs, hydrogen bombs, at least 1 week before. Even today we have the same level of excitement to, and after the festival is over, another 4 or 5 days, third shopping, fourth shopping, and then play crackers is all about the simple life. So doctor, 24-year-old, mayonnaise containing salad, what is your answer? It is an exotoxin which is formed prior to ingestion is what need to be understood. Now doctor, 32-year-old, profuse watery diarrhea with abdominal vomiting, and during a trip to Varanasi, jaldi bolo, Ganga Nadi mein kya behti hai? Huh? One loud answer. Cholera-like toxin. So traveler's diarrhea is most commonly produced by enterotoxigenic E. coli, which produces one heat labile, choleragen-like toxin, and a heat stable toxin. So this LT is the one which activates adenylate cyclase, ST activates the guanylate cyclase. Lot of times even secondary messengers are a favorite question. Now doctor, several children develop throat pain, cervical adenopathy. It is the adenovirus is what you need to remember. So you should remember calciviruses may, what are the two groups? Norwalk and hepatitis E. Paramyxovirus may you are having parainfluenza which lead to development of laryngotracheobronchitis is what you need to remember. And parvovirus is important because it leads to aplastic crisis in sickle cell disease. Now, a gram-negative marine bacterium leading to ear infection, very good. Vibrio alginoliticus is what you need to remember. Anybody thought parahemolyticus? I know. Most favorite wrong answer which I enjoy always. Then, what is except which is not bactericidal? Fatima, what is your answer for this? Volunteer something. Which is not bactericidal but bacterostatic. Superb. TG-cycline. So you must know the mechanism. Daptomycin, fluoroquinolones, metronidazole, nitrofurantoin, telithromycin, they are all bactericidal. Then how will basically daptomycin function, doctor? Mechanism. Generally one question on fluoroquinolones, tetracyclines, which 30 years, 50 years, 70 years, all these things you must wash the linen and go clean to the exam. One question will definitely come on antibiotic mechanisms. TG-cycline is bacteriostatic is what you need to remember. Now, Streptococcus pneumoniae you have injected intraperitoneally and it is fatal. What is the reason? Because there is a polysaccharide capsule which is considered to be the primary virulence factor. Only capsulated strains are the ones which are we are worried about. Now doctor, 22-year-old, triglycerides are 1500. लोवास्टैटिन किसके लिए इस्तेमाल करते हैं डॉक्टर साहब? कोलेस्ट्रॉल के लिए, ट्राइग्लिसराइड्स के लिए नहीं है. ट्राइग्लिसराइड्स आर डिफरेंट फ्रॉम कोलेस्ट्रॉल. So what will you tell a triglyceride high patients? Typically what is the lipid profile of a diabetic patient? Normal cholesterol with high triglycerides. The dyslipidemia which you see in diabetes. Okay. So if the insulin deficiency is there, what happens basically? Lipolysis or lipogenesis? Lipolysis that releases a lot of fatty acids which are packed into triglycerides which lead to development of hypertriglyceridemia in case of diabetes. So doctor, what is your answer? Jumfibrogil is fine. Something else you have to choose, Shamim. Huh? Abdominal pain and vomiting. Huh? Why cholestyramine and abdominal pain and vomiting are a consequence of the hypertriglyceridemia? Hypertriglyceridemia presents in the form of it can lead to pancreatitis also, pancreatitis episodes also. So what's your answer? Otherwise revise the answer. Beautiful. Niacin and jumfibrogil, even Fahima thought it as jumfibrogil and cholestyramine, the favorite wrong answer, but Shailu is right with niacin and jumfibrogil. Beautiful. And one more thing that you need to tell the guys with hypertriglyceridemia is exercise also has got an impact on triglyceride reduction. Now, but niacin is a very dirty drug to take, lot of side effects, not easy, but jumfibrogil commonly clinically practiced to be prescribed for hypertriglyceridemia. Temozolomide looks like acetazolamide but it is not that. So what is the mechanism? It is a oral alkylating agent. Beautiful, that's right. Then which antiretroviral highest amount of hypertriglyceridemia tendency? You like to say? Diadenosine and kidney stones. Huh? Ritonavir. Give one big clap to Dharani. Loud clap, loud Diwali clap. That's good. For you to remember. Huh? You'll remember better with a good clap. Ritonavir. Today only you should go and revise antiretroviral drugs without which there is no paper. So ritonavir. Then 78-year-old, fever myalgias with oseltamivir. What is the mechanism of oseltamivir? At what level of influenza's life cycle it will affect? Give some confident answer. You like to say replication? Replication is one answer I am listening. Goud, what do you say? Goud says virion particle release. Your name, doctor? Teja. Sai Teja, right? No, Teja, right. Teja, what is your answer? B. B looks convincing. Dharani? No, kuch propose karo, are. There is no negative marking with us. Only there are negative claps. Yeah. Very good. Virion. Don't forget this table, doctor. Definitely one question comes on the antiviral mechanism. At what level it will act? We discussed this thoroughly in our pharmacology Monday to Friday session. It is available in the video library, the online video library at online MBBS. Enfuvirtide, it will prevent virus from getting adsorbed onto the surface of the host cell, that is human cell. Amantadine, after the virus enters, it need to get uncoated, that is prevented. Then early protein synthesis होने के बाद it will get ready for nucleic acid synthesis. So all purine pyrimidine analogues will interrupt at that level. Then after nucleic acid synthesis, once more it need to reorganize its the viral coat. So for that late protein synthesis occur, that is prevented by protease inhibitors. Ultimately it need to get packaged and it need to get released. पूरा तैयारी होने के बाद. That level is prevented by the neuraminidase inhibitors. One of these levels is a common question, whether you take AIIMS, All India, PGI or any of the state entrants. So oseltamivir is what? Basically a neuraminidase inhibitor. So the release of the virion is what you need to remember. Generally antipsychotics, antidepressants, antivirals, antibacterials everybody will study. In MBBS what is studied in pharmacology, after all only that we will pass exam. But we leave antiviral, antipsychotic, antidepressant. Lot of students will not know even SSRI is what, SSNRI is what, fluoxetine is which class of agent also. No problem. The point is, are we prescribing it? We are not. For exam sake we need to read. Later on if you don't become psychiatrist, all this knowledge is gone into hay. If you become obstetrician, you require oxytocin. You don't require oseltamivir. Oseltamivir may be required for personal usage. It's all right. Now, irritant induced bronchoconstriction. So which is antivagal bronchodilator? Which is most effective bronchodilator used in COPD? What is the main mechanism of COPD? Is bronchoconstriction. It is vagally mediated. So there more than salbutamol like beta 2 agonistic agent, more than that ipratropium like a antivagal agent is the one which is basically most useful. Now doctor, myoclonic seizures, what is your answer doctor? Question number 27. You want to say valproate? Looks reasonable. Next 5 exams we will ask you mechanism of action of each of these newer anti-epileptics which act at thalamic level, at the receptors in the thalamus, etc., etc. So be prepared on that topic. Gopi is proposing baclofen, absolutely wrong. Valproate is what you need to remember. So it acts on the GABA and NMDA receptors as well as sodium and potassium receptors is what you need to remember. So doctor, simple partial, what is the best choice? Carbamazepine. Complex partial, carbamazepine. Tonic clonic, phenytoin and carbamazepine. Myoclonic is valproate, absence is ethosuximide. Now 34-year-old, male asthmatic, wrist drop, eosinophil count high. Array, classical, very good. What is the answer? Asthma responsive only to steroids, and on withdrawal of the steroid, asthma exaggerates. Must make you to think of possibility of some vasculitic asthma, which is Church-Strauss syndrome. That is what we have discussed the vasculitis topic on Friday medicine class last week. Now, why wrist drop? वो बताओ फातिमा, why wrist drop? Church-Strauss vasculitis है ना, तो इसलिए it will typically go and involve the vasonervosum of the nerves. So there is a nerve palsy because of that. Now BB 220 by 120 with sudden death. If you do autopsy, what will you discover? A flea-bitten kidney. A swollen kidney with a flea-bitten surface with multiple hemorrhages is the pathological hallmark of a malignant hypertension. Now doctor, fasting gastrin levels are elevated with refractory peptic ulceration. So what is your diagnosis? Gastrinoma. So gastrinoma can be part of MEN1, pituitary, parathyroid, pancreatic gastrinoma. All three central structures is MEN1. Similarly, you have autoimmune polyglandular syndrome type 1, type 2. Another very useless mugging topic. You have to read. Glandular type 1 syndrome में what will be there? Type 2 में क्या होगा? Now doctor, porphyrias, they will be haunting you like the last janam sins. So tell me doctor, what is your answer? The only autosomal recessive pattern is congenital erythropoietic porphyria, is what need to be remembered. So, so which enzyme, which porphyria? That match fixing is there no dirtiest job of porphyrias topic. I always used to hate when will be entrance over kind of a waiting used to be there. But one has to read, one has to pass through that filter called unfortunate competitive filter. So that's the reason don't regret when your scores are little low in the mock test. If you read, you will make it. If you read what is commonly tested, you will definitely make it to entrance. That is a simple rule. Sexually active 22-year-old with bloody vaginal discharge with triplex karyotype 69. What type of problem is it? Complete या partial? शमीम जी, आप ऐसे छोटे-छोटे चीजों में बड़ा-बड़ा mistake मत करना. Our future obstetrician, gynecologist of the Mehdipatnam, Charminar, we will be sending as a physician. I can send hundreds of patients every day. So you must be always, you should never fight with a physician. MD general medicine guy, if you happen to fight entire community, you are losing, right? So tell me doctor. Partial mole is what you need to remember. Partial mole. Very good. Tara, Shailu, Geolhak, everyone is ready for the. Tara, Shailu, Geolhak, everyone is ready for the. Yeah. So let's take up the next question. Complete and partial mole, doctor. At this level in November, you can't do mistakes, please. Now, in ITP, what do you have? Simple question. Bleeding time. Person is responsible not only for his actions but also the logical sequences of those actions. On a rainy day, going for a night stop with a girlfriend is not sufficient for the pregnancy, for the baby delivered. Ultimately, the baby going to MD preparation, you will be responsible until that stage. So be very sure. So what is that called as? Law. Novus actus interveniens. Anybody by mistake said recipsal occipital? No. No? Recipsal occipital means what? You don't need any special technical knowledge. The fact itself is speaking the truth. Your face itself is telling where you were there in the last night. So that is called as recipsal occipital, right? So that is very, very important. Regarding fingerprints, all are used except copper arsenate is not used, silver nitrate, lead carbonate, French chalk, all these things are very, very commonly used. Now doctor, dermal nitrate test is used to detect gunpowder residue. Peakman's test, hemochromogen test. Test gives negative results with the old stains. So you must be sure old and new stains, which tests are used in forensic laboratory science. I leave to you the literature. Where you don't have at least the topper in the MD entrance and the guy who didn't qualify in exam, both CSF will be same. There is no ABO grouping for the CSF, be very sure. So, when is World Health Day? Nowadays too, we have Mother's Day, Father's Day, ex-boyfriend day, Valentine Day. So, 7th April. What is the key difference between dispensary and PHC? Comprehensive health care is all the concept of PHC. Leptospirosis, it is the floods which lead to. For the MTP, whose consent is needed? Only the wife. Then we'll run little faster. You have 3 socio-economic groups and you want to compare them statistically. What is the best test available? ANOVA, which is analysis of variance, is what you need to remember. So you must know student t-test, chi-square test, when will you use? A little bit of biostatistics. Generally, out of 10 to 12 questions in preventive medicine asked, those 2 questions of SPM is biostatistics is the only bottleneck, which you need to be quite sure. We will have a quick review one of these days on the biostatistics before the exam. Drawbacks of a hospital based data is what? Except what is denominator? Denominator is entire population. Yeah, that is a drawback. No, in hospital based data you don't get the entire population. Provides only the, you mean to say it won't provide the denominator, alright. It doesn't provide denominator, entire population is not your hospital, right. Now, if a transmission is stopped so that it doesn't exist, we call it as elimination, very good. Then comes breastfeeding. What is the present recommendation, doc? Exclusive breastfeeding without any other drinks is what you have to give till 6 months is a best thing. What is wrong out of all this? Daily is one last year of healthy life due to MD preparation is called as dailies. Let not too many dailies add into your life. By next Diwali you may be planning to burn crackers, but you have a call from the hospital that you need to attend theatre, or maybe a patient of acute stroke has presented, whom you have discharged on Naraka Chaturdasi has come back. On TIA he had on Naraka Chaturdasi, and by Diwali he came back with full blown stroke, right. And in fact, if you want to learn burns management, the best day is Diwali night duty. If you want to learn road traffic accidents and all sorts of trauma, New Year day is the best day. So don't lose few things. and pathogenesis phase, give me an answer. So basically interventions like immunization, chemotherapy, giving BCG doesn't prevent TB, but when TB comes it will be not that severe, it won't be miliary if somebody took BCG, that's the idea. Now picking up every 5th or 10th unit regular intervals is called as systematic random sample, very good. These are all larvicidal, which is anti-adult measure. Malathion, organophosphorus, these are all basically anti-adult. Mineral oil, Paris green, synthetic insecticides, they are all considered to be larvicidal agents. So that insecticides, 2 pages in Parkinsonism, doctor, like an insect, you have to complete reading because examiner's favorite area. Now comes the general medicine.